If you've ever gone for a walk and come back feeling more pain than pleasure, it's so easy to just chalk it up to getting older. But what if that's not the real story? What if those aches in your knees, that nagging in your back? What if it's not about your age at all, but about a few simple, totally fixable mistakes? Okay, let's dive in and figure this out. A patient actually said this to her doctor not long ago. She'd given up her morning walks, something she loved, because of her throbbing knees and aching back. And it's just heartbreaking, isn't it? Because so many of us can relate to that feeling, that little voice that says our bodies are starting to fail us. But this is the question we really need to ask ourselves. Is it the years on your body that's the problem? Or is it how you've been using it for all those years? The belief that pain is just an inevitable part of aging is what holds so many of us back from enjoying one of the simplest, best forms of exercise out there. So here it is, the big takeaway. Your body isn't broken. It's probably just asking for a few small adjustments. We're going to completely reframe this problem. This isn't a story about decline. It's a story about technique. And the good news is you have way more control than you think. So here's our game plan. First, we'll talk about why your walking form matters so much. Then, we'll break down the fixes into 3 parts: the setup, the form, and the habits. And finally, we'll cover how you can take your first step forward, starting today. All right, let's start with the why. After 60, our bodies just aren't as forgiving as they used to be. It's natural. We lose a little muscle mass, our ligaments aren't quite as elastic, and our joints take a little longer to get lubricated and ready to go. It just means our built-in shock absorbers aren't as bouncy as they were back in the day. Now, check this out because this is so important. Walking is basically a series of controlled falls. And with every single step you take, your body has to absorb a force that's 1.5 times your body weight. Now, if your form is good, your muscles soak up that shock, no problem. But with bad form, that entire impact, that entire jolt, goes straight into your knee joints and puts a ton of stress on your lower back. So, how do we fix this? Well, it all starts before you even really get going. This brings us to section 2, the setup. This is all about preparing your body and your gear before you even take that first real step. Okay, mistake number 1, starting way too fast. Stepping out the door and immediately hitting a brisk pace, that's like trying to redline a car engine that's been sitting in the freezing cold all night. It's a shock to the system. The fix is so simple. It's the 3 to 5 minute rule. Just stroll. Take it easy. This gentle movement is like a signal to your body. It tells your joints to start producing that lubricating fluid and lets your muscles warm up, getting them ready for the real walk ahead. All right, let's talk about your gear for a second. A lot of us are walking around in what you could call dead shoes, and we don't even know it. See, that foam cushioning inside has a shelf life. Over time, it gets compressed and just stops absorbing shock. Walking in dead shoes is kind of like driving a car with shot suspension. You feel every single bump right up through your joints. So here's what you want to look for in a good pair of walking shoes. You need good cushioning in the heel for impact, solid arch support to keep your ankle from rolling, and a sole that's flexible where the ball of your foot is so you can push off naturally. And here's a good rule of thumb. If your shoes are more than a year old or you've put about 300 to 400 miles on them, yeah, that internal support is probably gone. It's time for a new pair. Okay, so you're warmed up, you've got the right shoes on, perfect. Now let's get into your actual walking form, how you're holding your body while you're moving. This brings us to that slumped walking posture we see all the time. So many people look down at their feet, maybe afraid of tripping. But get this, your head is heavy. It's like a 10 or 12-pound bowling ball. When it's balanced right over your shoulders, it feels weightless. But the second you look down, the strain on your neck and upper back can double or even triple. It also crunches up your chest, which makes it harder to breathe and just robs you of energy. The fix for this is actually a pretty cool and simple little mental trick. As you're walking, just imagine there's a gentle string attached to the very top of your head, just lightly pulling you up towards the sky. Let your shoulders relax and drop down, away from your ears, then lift your eyes and look about 15 to 20 feet ahead of you. Trust me, your peripheral vision is more than enough to spot any cracks in the sidewalk. Next up, let's talk about dead arms. Walking isn't just a leg exercise. It's a full body movement. When your arms just hang there all stiff and limp, your lower back has to deal with all the twisting force your legs are creating. But a natural arm swing, right arm forward with the left leg, left arm with the right leg, it acts as a perfect counterbalance. It stabilizes your whole torso and just makes your walk so much smoother and more efficient. All right, we've covered the setup and the form. Now for section 4, the habits. Let's look at how consistency and avoiding a couple of modern-day traps can keep you walking pain-free for years and years. This chart right here, it highlights a super common mistake, being a weekend warrior. That's the person who doesn't move much all week and then tries to make up for it with one monster hike on the weekend. But our bodies love consistency. They don't love sporadic, all-out efforts. Those frequent, moderate walks send a constant signal to your body to stay strong and flexible. That long weekend hike on a body that's not ready for it, well, that's just a recipe for injury. And now for a very modern mistake, the phone zombie. We've all seen it, maybe we've all done it, but looking at your phone while walking basically undoes all the good habits we've just talked about. Your head is down, which ruins your posture, your arms are locked in front of you, which kills your natural arm swing, and honestly, most importantly, it's a huge fall risk because you are completely tuned out from what's going on around you. The fix here is simple, and it's totally non-negotiable. If you need to check your phone, just step off to the side of the path, stop walking, do what you gotta do, put the phone away, and then start walking again. It's all about protecting your body and, your safety. Okay, let's talk about the final mistake, and this one happens the second your walk is over. Just think about it for a moment. What's the very first thing you do when you get back inside? For so many of us, it's collapsing into the nearest chair. Here's the thing. When you immediately sit down, those hardworking leg muscles, your calves, your hamstrings, they start to cool off and lock into a shortened, tight position. That's what leads to that awful stiffness later. The fix is a super simple 3-minute recovery. First, drink a big glass of water. Then, gently stretch out your calves against a wall and then your hamstrings. It just tells those muscles, hey, the work is done, you can relax and go back to your normal length now. Wow. We've covered a lot of ground, haven't we? But look, the goal here isn't to overwhelm you with a giant to-do list. It's to empower you. So let's talk about how you can make all this information actually work for you, starting right now. Please remember this. The goal is progress, not perfection. You do not need to go out on your next walk and try to remember all 7 of these things at once. That would be totally stressful, and it probably wouldn't work anyway. The approach is much, much simpler. Here is your action plan. It's just 3 steps. Step 1, pick just one thing. Maybe it's the 5-minute warm-up stroll, or maybe it's that string on your head idea. Step 2, on your very next walk, just focus on doing that one thing. And step 3, just notice. Notice how it feels. That's how you become an active partner in your own health. And that brings us to our final thought. You now have the knowledge to turn your walk from something that feels like a painful chore into a joyful, healing activity. It was never about being too old. It was always about learning to walk smarter. So the question is, which one will it be? Which walking mistake are you going to fix first?